Right, hi everyone. Just a couple more videos for us to do. One is about renal replacement therapy, so I'm just going to show you how we prescribe that on the new system. It should be a bit easier than it was in the past. So you're all familiar with the ICU admission M pages and the manage, which will become ward round eventually. So when it comes to prescribing renal replacement therapy, you can do it one of two ways. You can do it through requests and care plans, which is in this menu here. I'm trying to encourage people to use the M pages for more stuff because it just means that you can get everything and get access to everything from one form. So what you can also do is you can go to new order entry, and within there you can type in BTHFT CRRT, and that should find this one, which is Med CRRT ICU. And if you click on that, and then that will appear in your inbox here for signature. And then when you click sign, it'll take you over to the renal replacement therapy power form eventually. So here, this is the prescription for all the different fluids. Everything's pre-ticked, so you don't really have to do anything. All you have to do is click orders for signature. These are all the different fluids which would automatically be prescribed on a paper form anyway. And then when you click orders for signature, that will sign those fluids and it'll open a power form. Everything here, some of the stuff here has been pre-ticked just because this is a test patient, but all you have to do is type in the height of the patient, it'll calculate the ideal body weight, and then just click the indication and the type of therapy that we're providing. It'll usually be hemodiafiltration or filtration, occasionally it'll be dialysis. The anticoagulation mode will be preset to citrate, but you can change that to any other form. If you do prescribe heparin, then you might have to you would have to create a separate prescription for the heparin, and then you type in the dose. So that'll be 25 mils per kilogram per hour or 35 mils per kilogram per hour. You can also have other. It's going to be very unusual that you want to do that. And then we've put the protocol here for the prescription for the renal replacement therapy here. So you can then just type in the dose depending on the weight. It doesn't calculate it automatically, unfortunately. So if we assume that this patient has an ideal body weight of nearly 70, then the blood flow is going to be 100. The replacement post filter will be 200. The dialysate flow will be preset, and you can set the fluid removal rate to however much you want. We'll keep them equal for now. And then there's also a citrate prescription set up there as well, in case you need it. If we were on hemodiafiltration, you could then put in a dialysate flow, but because this patient's on CVVH, we're not going to bother with that. And then we click OK. You can click this so that it doesn't have to show that you're confirming in the future, and then you can sign. And so that's the prescription complete. Now we're supposed to be reviewing, just click sign there, we're supposed to be reviewing these power forms every day. So that's how you first initiate the prescription, but then in the future when you want to review them, you'll have to go to ICU forms and click CRRT review, and then you'll have the option of either just reviewing the settings, which you can click here to review. These are the settings that we just prescribed. Or you can discontinue the therapy. And if you discontinue the therapy, then it will remove all those prescriptions. So we'll just click setting reviewed, and then that. And that's complete. So that's how you prescribe the initial CRRT, and then how you review the settings each day afterwards, which needs to be done every 24 hours. Thanks.